we've got very exciting next presentation from our very own Vita Christie. Now, Vita is the manager here at the Poche Centre for Indigenous Health at the University of Sydney. She's currently completing a PhD that's focused on improving breast cancer outcomes for Aboriginal and Torres Strait Islander women, or particularly Aboriginal women, and that's what she wants to present on today. So, Vita, the floor is yours.
Thank you, Tom. Okay, so I'm assuming everyone can hear me, though we've got no way of telling. So there's that. I'm here today to talk about a project that is aimed at improving breast cancer outcomes for Aboriginal women. And it's a mixed methods study that we have we are working on the protocol for at the moment. As Tom mentioned, my name is Vita Christie, and I am actually a PhD candidate of Macquarie University, though I do work at the Poche Centre. And the project partners for our project are, as you can see on the screen, Armagen Aboriginal Health Service, with whom we would not have gotten anywhere without. The Foundation for Breast Cancer Care, whose generosity have really helped this. Obviously Macquarie University and the Poche Centre for Indigenous Health. So I will start by acknowledging that we are all on the traditional lands of Aboriginal and Torres Strait Islander peoples in Australia, and that I myself am on Gadigal land in the Eora Nation, and I would like to pay my respects to elders past, present and emerging. So the reason that we are doing this study is, excuse me, I just have to shift my screen, that what we do know already is that while the incidence of breast cancer is lower in Aboriginal women than non-Aboriginal women, the mortality rate is still higher. Across Australia, Aboriginal women are 1.2 times more likely to die from the disease, and in New South Wales alone, Aboriginal women are 69% more likely to die from breast cancer than non-Aboriginal women. So in knowing that, this project is all about co-designing and then evaluating a pathway and aiming to make a more timely and culturally safe screening, diagnostic, treatment and follow-up services for Aboriginal women. So the background of this was a mapping project that took place in 2018. I was not part of the team that did the mapping project. It was led mostly by a student, and basically what the mapping project did was work within 4 locations within one region of New South Wales, in the Hunter, New England area, and looked at what was currently happening with screening, diagnostic, treatment and follow-up services, and also did extensive interviews or focus groups with the community to ask about how anything that was happening at that stage might be improved, more welcoming and suit the Aboriginal community better. So at the end of the mapping project, 11 recommendations were made to adjust what was currently happening, and we've used co-design methods to map a new, more culturally safe pathway. And this project that I'm talking about today is sort of putting all of that into practice and evaluating its efficacy. So the recommended adjustments that came from the mapping project can be seen on the screen. The first was that there would be a screening day event. So, you know, as we know, in more regional areas, a lot of this happens in a breast screen bus. And so working with Breast Screen to put aside a day for Aboriginal women only, where there are Aboriginal staff available to assist them through, and also where there might be childcare, transport is organised to and from, they share a meal, there's refreshments, those sorts of things. And so making it a kind of event. But outside of that, if someone's not able to attend that event, having an Aboriginal health worker present at a screening van at stipulated times. And letting the community know when those times are and booking those appointments out for Aboriginal women only. As I mentioned, providing transport to any of these adjusted events. And something that came quite strongly from the community in the interviews was that having community spokespeople. So the mapping project did talk to at least a few breast cancer survivors who were keen to become spokespeople, and particularly keen to become spokespeople knowing that that the actual pathway had some modifications to it. And if they could sort of get out there and talk about why this would have been helpful in their experience, and or why it's much more welcoming for others who have never experienced it before. Also, as a recommendation, directory booklets for the women. As you're probably also aware, in rural and remote health in Australia, it's not that you can't just go to the local health service and get anything you need. And so in the area we were working with, there was a local oncology department, and you'll notice that one of the recommendations was to create a culturally appropriate area in that. Everyone will be familiar with the idea that there is often men's business and women's business in Aboriginal health and or Aboriginal culture. And so things like oncology departments being sort of aware that there needs to be privacy, that it could be welcoming, you could have flags, paintings, etc. But also that, for a lot of these people that, once they've received something like a diagnosis, it's extremely hard to know kind of what the next steps are. And so one recommendation was a really kind of clear GP management plan prior to treatment, but also a directory booklet for so that you can get something like chemotherapy nearby, but you can't access radiation. And so where do you go for radiation? And when you go there, what is available in terms of accommodation, and what is available in terms of transport? And can you take family members with you? All of those sorts of things. And so those sorts of directory booklets, and also a directory booklet for the health services, because it's a movable feast, these services, and places like Armagin Aboriginal Health Service need sort of updated information on where they can be directing people to go. That the follow-up care plan and the follow-up phone call happens post-treatment. A few women mentioned that they sort of feel that they fell through the cracks after they went through the treatment, and then an ongoing cancer support group for Aboriginal women only in the area was a recommendation. So I feel I am preaching to the converted that co-design is a research method recognised to enhance collaboration between those doing the research and those impacted by the research, and that co-design has been used to significant effect with Aboriginal communities. And I think everyone's aware of that who is present today and was present yesterday, as each of the projects has actually relied on co-design or privileged co-design. So this project is an iterative project. We are going to be gathering both quantitative and qualitative data from it. And it's in 5 main phases. And so the first part of the phase is the planning phase to ensure that there's appropriate governance, that we are forming an Indigenous advisory group, but that we also have a good amount of experienced Aboriginal researchers on our team. That we make sure that the invitations to any of the modified events are out there, make sure that there's information out for the community about any of the follow-up services that they need. Obviously collecting data from the outcomes of these planned or modified events, and then analysing that data and reporting it back to community, making sure that it is in line with and agrees with how the community feels the improvements could be made or have affected them. And then obviously evaluation of the co-design process, and hopefully adaptation for future use in similar environments. So what we all know is that without culturally safe access to things like screening and treatment opportunities, the gap in health outcomes is going to widen. And I think it might have been Julie Sater that said yesterday, we know that cultural safety equals clinical safety, and that really resonated with me. And so our team is a team of experienced Aboriginal and non-Aboriginal investigators and community representatives. So we've developed this together, and we'll evaluate it together, and hopefully we'll experience the success together too. Thank you.
Vita, well done. Exactly on the very minute. Yeah. So any questions?
Not just yet. We've got some information on Twitter. Great presentation. Great presentation. Thanks for sharing this research, Vita. It will be terrific to see the project implemented.
Thank you, Connie. You probably might be a bit sick of hearing about my project right now.
Vita, I have a question. Now, one of the issues that we've got with breast cancer screening is, and I know you're just looking at New South Wales, but nationally, is being able to get access to the screening vans. But and I should say that I'm a member of Cancer Australia's Cancers Leaders group, which we're looking at all Indigenous cancers, and it's the problem that we encounter is that unless there's a close relationship with the local AMS, when women get in and get screened, if there's any follow-up treatment or follow-up investigation, even before there's anything identified, that becomes a real problem because, if somebody gets a letter just saying you need to go and see a specialist, what do? So I think that's a really important area.
Yeah, and so obviously it's going to be reliant on the local AHS or Aboriginal Health Service and Breast Screen working really closely together on that very first part of this, and then ongoing, the AHS needs to be very much across what happens after that.
Yeah.
And the community, the reason that this has had any success so far or will have any success is because the Aboriginal Health Service we're working with has a really strong, bond with their local community. And last time I was there, I remember sort of, saying, oh, we need to are we able to contact this person? And the Aboriginal health worker that I was working with said, I'll probably see them in the supermarket this afternoon, so I'll bail her up when I'm there.
Yeah.
And so, yeah, all of that is really important, and part of that is absolutely that Breast Screen has close direct contact with the Aboriginal Health Service, and that then the Aboriginal staff at the Aboriginal Health Service are able to, closely follow what happens with the women afterwards. Yeah.
Because the challenge also is that only about 50% of the Aboriginal and Torres Strait Islander population use an Aboriginal medical service. The rest use mainstream, and so how do we capture them? And the other real big challenge is getting that population health approach, education approach to get screening, that people don't avoid it.
Yeah, so that will remain an issue, definitely, and we are really lucky to be working with a really closely knit community in that the Aboriginal Health Service has really close ties with the local health service and the Aboriginal liaison officers at the local health service, and so that's all. But yes, that's not going to be in place naturally for everybody, and I guess, in the long run, that needs to be part of our findings, that was a part of the success of this, those relationships.
Yeah, and we can learn off what Poche here did with oral health. When you're able to partner with a local service deliverer, you get better outcomes than just going in blind and hope for the best.
Absolutely, yeah.
Okay, any more questions?
2 comments. One from Emma Edwards. Fabulous presentation, Vita. I'd love to see how we can also incorporate taking a family history to ensure that they have access to familial cancer services too.
Right, that's a really good point.
Yeah.
Yes, I'd love to touch base about that directly, Emma.
And then another, can't see who this is from. Great work and great collaboration with Armagin and the community, from another member of the audience.
That's just John. Thanks,
Oh,
John.
it's John.
Armiger's been a great partner.
It's just my box.
We've got another. Tom, how much do underlying AEWB issues make it difficult for, I thought so.
Yeah, social emotional.
Social emotional well-being issues make it difficult for women to seek care.
Yeah, no, that is one of the big challenges that we've got. And in fact, Professor Pat Dudgeon over at Uni WA, Poche WA, is doing a lot of work through through her National Centre for Best Practice in Suicide Prevention, looking at the social emotional wellbeing framework and trying to address these issues to allow not only women but all members of our Aboriginal and Torres Strait Islander population to be able to address social emotional wellbeing, to be able to access and want to access and know that they can access in a safe environment, services. So it is a challenge.